Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating young woman. Welcome, welcome, welcome to our show. Please tell everybody your full name, where you're based, and share your story with us today.
Hi, I am Dr. Jameca Woody Cooper. I am a board-certified counseling psychologist, and I am based in St. Louis, Missouri in the United States. I've been practicing for about 20 years, and my story starts as a young girl in Arkansas, in southeastern Arkansas, which is a state in the southeastern part of the United States. I was born in South Carolina. My father was in the military, in the Navy. We moved around a little bit, and then we settled back in Arkansas, which is where my parents were both from. So I finished high school in Arkansas, went to college at a college called Tougaloo College in Jackson, Mississippi, and it is an historically Black college. So I graduated from there and went directly into graduate school at the University of Missouri-Columbia in counseling psychology. And interestingly, I did not plan to be a psychologist my whole life. I actually planned to be a physician. My original plan was to go to medical school and to be a doctor until I realized I fainted at the sight of blood. So I had to course correct, think of other careers that would be fulfilling for me, and from those I selected psychology. And I've been doing it probably almost 25 years now, and it's been more than rewarding. I've done a variety of things. My first job out of graduate school was an assistant professor. So I did that for about 4 or 5 years. And then from there, by the time I was having my children, my youngest son was born prematurely. So he required hospital care for a few months, and then more care and therapies once he got out of the hospital. And at that point, I had 2 sons, a 3-year-old and a newborn. So I left my job at the university, took care of my son for a while. And then one of my friends that was a physician asked me to see a few of their homebound patients that were struggling with mental health issues in their homes, but were not able to leave their homes. So I began seeing a few of their patients, I guess about over 15 years ago. And it's now transformed into thousands of individuals being seen by me or those in my private practice in St. Louis. I've had a practice here almost 20 years, and my practice started off being dedicated only to older adults and psychological therapy, but since then it's expanded. I have three different social workers who work in my practice, receptionist, social media person, and practicum students as well. So it's grown from just me to other people. And now the practice doesn't just focus on older adults, but it also focuses on adults, children and adolescents, couples and families as well. So we've been here many, many years. I enjoy what I do. Through the course of that, I've also taught graduate school. I was a program director at a Webster University, which is a private university based here in St. Louis. I was the program director over the school psychology program and the master's in applied educational psychology program for a few years, about 5 to 7 years. And now that program has ended. I still teach adjunct at Logan University, which is a chiropractor school here in St. Louis, and I teach abnormal psychology and aging, 2 different courses, of course. So I do that. And in addition to that, I also do work in forensic psychology, where I'm working with attorneys to do psychological evaluations on their clients who are usually defense cases. And so I'm doing evaluations and also expert witness testimony in that capacity. So a few different things I do. I like to keep my hand in a lot of different areas because that's what it takes to keep me engaged and fulfilled. And I love my job. I really can't imagine doing anything else. I've been doing this, I guess, for almost 25 years in some shape, form, or fashion. And who knew that mental health would be the booming area that it is now? When I went to school in the 90s for it, but I'm glad that it is. And I'm also very happy that mental health has become more mainstream with a lot of people. And so now people see it as acceptable to go and get therapy. They see it as acceptable to have to take medication for mental health issues. And I think that's a huge positive step we've taken, not just in the United States, but all over the world. So I'm proud to be a part of that.
Absolutely wonderful. Thank you so much for coming online and sharing your story with us today. Now, let me take you back a little bit to your personal journey and your professional background. Your upbringing in small Arkansas town with a very large extended family must have been quite unique. How did your earlier experiences shape your path towards psychology and advocacy?
Well, I think growing up in my town, it's really small, so not a lot of different people. I didn't have exposure to a lot of people in various types of work, so I didn't even really know what a psychologist was at the time that I decided to be a psychologist. But I had seen doctors, so that was my first career choice. But growing up in a large extended family, I say it's probably unique, but it was also very lively. It was fun for me. I didn't really realize probably until I got maybe, I don't know if it was high school or college, that everyone didn't come from huge families like I did. I didn't know that wasn't common. It was just all I knew. My grandmother had 16 children, and so my mom had lots of brothers and sisters. So I had a lot of cousins, extended family, second cousins, third cousins, and we spent a lot of time together. So I think it was probably unique in that way that I grew up kind of with my own village, just being my family.
That's an incredible experience. My mother came from a family of 11, so I know exactly what you're talking about. Grew up with lots of cousins.
Yes.
Now, when I was doing some research about you, I found that you mentioned Desmond Tutu's quote, and Desmond Tutu was one of my most favorite humanitarians. The quote is, "If you are neutral in situations of injustice, you have chosen the side of the oppressor." Now, you mentioned this quote as a guiding principle to your work and to your life. How has this influenced your work in mental health and criminal justice?
Well, I feel like as a person in mental health, advocacy is very important. Advocacy in the way of advocating for my individual clients, advocating for them on a statewide, regional, or national basis, advocating like with lawmakers, legislators about what services and resources people who need mental health services need. So advocacy has just been a big part of who I am. And I don't know that my parents or my family did much to make me that way. I just think it's my personality, because my personality is quite different from that of my cousins. I am the outspoken one, probably one of the risk takers. I can be a bit unfiltered where I was growing up. So I didn't mind consequences because I was more driven by facts, reality, truth seeking, and curiosity. And it didn't really matter what the consequences were to me. So I think I've kind of brought that into my profession as well, in that I've developed services in my practice just based on the fact that they needed to happen, or a demographic of people needed those services. It didn't really matter to me if it was right or what other people would think or how it would go over. I just felt like if people need services, someone has to provide those services. So that's always been my mindset. And I also feel that if you are a person that is in a position to help, to make a difference, to make a change, or to speak out, then it's up to you and it's expected of you to speak out and to do something, because being neutral, I feel like, is basically siding with the other side. If you're neutral, that is essentially going against the cause. So I try my best not to be neutral or try to be silent in any cause. I try to always have a voice, and I try to, those I teach in a teaching capacity or clients, I'm constantly advocating for them to have a voice as well.
That's wonderful. Now, as a Fulbright Fellow in Global Health, how did your international experiences inform your approach to addressing mental health disparities in the United States?
Well, it gave me a great deal of insight, because what I learned being a Fulbright scholar, one of my experiences was in Barbados, so in the Caribbean. And then another one was in the country of Kazakhstan, which is way on the other side of the the world. So two places I'd never been. Very different. Demographics look very different. Like in Barbados, they're people of color people, mixed people, biracial, as well as other ethnicities. So it's a diverse area of people of color. And then in Kazakhstan, of course, mostly the population is Asian. They're Asian people that speak often Russian and practice Muslim religion typically. So it's quite a mix. It was different for me being in both places. But what I learned is that the stigma of mental health is really worldwide, and it's not just in the United States, it's everywhere. And it's everywhere based on many, many different reasons. So sometimes tradition, sometimes race and culture, sometimes religion. But everyone has it everywhere. So it's a cause that needs to be improved all around the world, just not in the United States.
Now, I know that you've highlighted that access is limited to care as a significant issue in the mental health system. What strategies do you believe are the most effective in bridging this gap, especially for underserviced communities?
One of the things that we've been really active on in the state of Missouri with our legislature has been to try to get past the telehealth bill. Because one of the things during the pandemic that Medicare and other insurances did allow was telehealth services, because people weren't going any place face to face, so they allowed virtual sessions. But what we also needed, we needed to extend that. So we needed it to not just be virtual sessions, because virtual means audio, visual, video.
Yes.
But we also needed that to be audio only. That's an important part of access, because not everyone everywhere in the world has high-speed internet.
Yes.
And it's a class issue for a lot of people. And even in my state of Missouri, in rural areas, it's not something that's everywhere all over the state. So there are going to be some people who don't have internet services to support, video services. And one of the things I said earlier is that I work a lot with older adults. So me knowing that population well, I know that they don't always understand technology. They don't understand smartphones, laptops, tablets, apps, software, resetting, restarting. And sometimes it really frustrates them. So the last thing that I want to see happen is me coming in to help someone, and then the technology or the need for them to use certain technology interferes with that or makes them worse. So by having audio only telehealth, it really can allow some people who would not otherwise have services be able to benefit from mental health services.
Well, that's amazing, because these days we take for granted that everybody's got access to the internet. I lived and worked in Albuquerque, New Mexico, and on the reservations of New Mexico, it was the same thing. Even access to just clean drinking water was not there.
Right.
So, through the Emergence Psychology Services, you served St. Louis residents for nearly 2 decades. What systemic changes have you observed in mental health care during this time?
Well, one of the big things is virtual care. I see people being open to virtual mental health now.
Yeah.
And I would probably say just before the pandemic, so 6 years, I was attempting to do virtual 15 years ago, but we didn't have the codes or the billing codes. It was not acceptable at that time,
Wow.
just because the school of thought hadn't progressed to that level yet. So I'm happy to see that that's happened. I'm also happy to see a lot of African Americans and a lot of people outside of the United States more open to even having discussions about mental health and encouraging other people to seek mental health care. I think that's a huge step that I've seen, at least in the United States. I've seen that difference happen in the past 5 years.
Yeah, the stigma has been there for such a long time, but I think more and more people are now realizing that there's nothing to be ashamed of if you have a mental health issue, and seeking help is the smart thing to do and not to struggle on your own. Now, how do you approach tailoring psychoeducation to meet the diverse needs of your patients, particularly those in the marginalized backgrounds?
How I tailor my services? Well, typically tailor my services to meet individuals where they are. So whether
Mhm.
that's from individuals from marginalized communities or not, like I try to tailor services. I don't have a cookie cutter approach that I just use with all clients. I change it up based on who the client is and what their needs are and what is going to resonate with them the most. Um, and I think in that way, it makes it more um, comfortable and easier to receive for them.
Let's have a look at your criminal psychology and expert witness work now. Gosh, you've worked in so many different areas. So, in your role as a criminal psychology consultant and expert witness, what are some of the challenges that you faced when representing psychological insights in legal settings?
Well, the challenges I face here, I'm in the middle of the country, in Missouri, which is a red state, so it's a very conservative state, which usually, unfortunately, means a lot of discrimination is in the state. So, what I've seen is that judges are quite biased in how they see defendants, how they see everyone really who enters into the courtroom. And that's an unfortunate part about the criminal justice system here.
Mm.
So many times we like to think or believe that you're innocent until proven guilty. But in fact, a lot of times it's quite the opposite in this case. So people of color, poor people, those with disabilities, including mental health, they have very much an uphill battle because they're not often seen as victims of the system when in fact they are.
Yeah, that's really sad. Now, you've appeared on criminal documentaries like the Discovery Channel's Court. How do you balance public education with the complexities of forensic psychology?
That's a really good question. And I think public education is such a wide range in what people understand. And I think sometimes we as psychologists, we are kind of speaking to people up here, like we're using psychology language and big words in that, but sometimes people need you to bring it down to a level that they can understand. So what I really enjoyed about the shows that I did with criminal psychology is being able to speak about psychological issues through a criminal justice lens in a way that people can understand it. I really appreciate that.
Hmm. So, what ethical considerations guide your work when consulting on criminal cases, especially those involving the vulnerable populations?
I would say the same ethical principles that guide my work as a psychologist, which of first concern to me is doing no harm to anyone, trying to understand people's various backgrounds, allowing people to have the autonomy to decide for themselves what is best for them. I have knowledge, of course, being a psychologist and knowing what I've done for the past 20 years, knowing what the research says, what the experts say, what medicine is best, but I try to allow everyone to make informed decisions and have the autonomy to make decisions that are best for them instead of coming in paternalistically, like I know what's best for you. I try not to take that approach with people because I feel like people should have their own rights to decide what's best for them, even if it's not what I think is the right thing.
Yeah. Now you hold various leadership roles. You've got a very impressive resume. As the president of the Missouri Psychological Association, what initiatives have you spearheaded to promote mental health awareness and equity?
Well, one of the things we worked on really hard this year was the legislation, and we just found out last week that it was passed with the audio only bill in Missouri. So that was one of the things we were working on, advocacy. One of the other things that I work on a lot is engagement from members in Missouri. So students, trying to get more students involved so that they can understand what the professional journey might look like as a psychologist once they get out of school, to engage our younger career psychologists and to just really kind of connect people all over the state. Although I'm on one side of this, I'm on the very, very far east side of Missouri. We still have people on the very, very far west side of Missouri. And I think a lot of times we're so busy working, doing what it is that we were trained to do, that we miss out on those kind of individual connections with our colleagues and with each other. So one of the things I've been really interested in is engagement.
That's wonderful. Now, your involvement with organizations like the Association of Black Psychologists and CARE STL really highlights your commitment to the community. How do those roles enhance your impact on mental health advocacy?
Well, I think of being able to work like with CARE STL and the community at a community health center, and some of the other boards that I've worked with, allows me to see mental health through the lens of the people that they serve. So whether that's lower income individuals, whether that's individuals with hearing and speech difficulties, whether that's those with disabilities, it allows you to see what services those individuals specifically need. And sometimes that's one of the things we miss, like as mental health practitioners, because we're usually kind of siloed in our area, and we usually work with similar demographics, and that usually doesn't change probably over the course of our careers much. So being able to see what the needs are outside of those we work with, I think has been very helpful for me.
Now, the United States has changed drastically in the last 100 days plus, and the elephant in the room is addressing racism and trauma. Now, in discussions on racism and mental health, you've emphasized the trauma experience of Black Americans. How can mental health professionals better support clients navigating these challenges, especially right now?
Well, I think right now more than ever, we're seeing individuals being burdened, like with the impact of trauma. Because in a lot of ways, like what we're seeing now with our government in the United States, um, it's new, but it's not new. Right? It's new in the fact that it's a person that we haven't seen do these exact things in this exact way, but we've seen the types of people before. And as people of color or marginalized individuals in this country, we're no strangers to bias, discrimination, and oppression. I think what we're seeing now is something on a different scale. It's something that is really trying to roll back a lot of the rights and the liberties that many people have fought for. because truth and reality and history is being threatened,
Mm.
because they can make up narratives that are a little bit more palatable, that don't involve such realities as some of the things that have happened in this country, such as slavery, such as Japanese internment camps, Native Americans, the genocide and reservations. So many things that have occurred in this country that so many people would rather not speak about. But
Mm.
for others of us, it is our reality. And that is our day-to-day struggle. And we still live with the consequences of that. So it's very hard for a lot of people in this time to remain hopeful. And I think when people lose hope, sometimes it can be triggering for them because it can remind them of other situations that have been traumatic. So I feel like my role as a mental health clinician is to really help people unpack what that trauma is and why.
Mm.
Because it could be different types of trauma at different times in their life. But what isn't helpful, and what we know and what studies have shown over and over again, is that suppressing the trauma, denying the trauma,
Mm.
covering it up, not speaking about it, not sharing about it, is very detrimental, not only to individuals' mental health, but their physical and medical health as well.
That is so true. Now, I know that you speak a lot about the importance of acknowledging the trauma in the Black woman's experiences. How does this understanding influence your therapeutic approach? And I really want to touch on this because a lot of people think it's a myth, right? I lived in apartheid South Africa. I know what it's like to be a Black woman in a racist environment. Let's talk a little bit about that.
I think for a lot of women of color, it's racism exists, and
Mm.
it's one of the biases or types of biases they deal with on a daily basis. But for women of color, it's also other ones that you add to that list. It could be sexism, it could be classism. If they're lesbian, gay, bisexual, transgender, it's also that as well. So these different discriminations and bias compound on the lived experiences of African American women or women of color, and it makes it quite overwhelming for many of them, because that's a lot of different types of bias and discrimination to deal with on a daily basis, and
Mm.
yet possibly be told to get over it, or yet be told that, oh no, you're making things up, that didn't happen. So it's the continued trauma of being ignored or being dismissed that usually goes with it. So as a Black woman who's experienced that in various contexts, I can definitely attest to it, and it helps that I can understand and sincerely appreciate what many of my clients have lived through.
Mm. There's a lot of work that still needs to be done. Now, I'm going to end our interview with two questions, which are a bit of a thought experiment. In the one, I'm going to take you back to the younger you and ask you if you could go back and give yourself three nuggets of wisdom, especially if there is some emerging psychologists who are listening to this interview now who are aspiring to integrate their clinical practice with community leadership. What three nuggets of wisdom would you give based on what life has taught you up until this point?
I guess the three nuggets I would give is, to one, go get the best training possible. Don't just go to a school to get a degree. Go to a very good school, because that will help you along the line to have the best education and the most credibility to go with that education. It's no good to get a degree if no one respects where you got your degree from, or no one believes you're knowledgeable. So that's the first thing. I would also say, don't be afraid to take chances. Try things, go places, do different things. You don't have to follow a laid out script. You get to really cultivate the life and career you want. And then the third thing I would probably suggest is, for especially for women of color, to go seek out mentors, because no one can guide you in the right direction or tell you to steer clear of potholes like those that have already gone and experienced those potholes. So I think sometimes representation matters a lot, and finding people who look like you that can support you will be a huge asset along the way.
Fantastic. The last thing is, what do you do for your own self-care? You're not just a psychologist dealing with a lot of traumatic issues on a daily basis, but you're a mother, you're a wife. How do you juggle all of these aspects of yourself and focus on your own self-care?
For me, I keep very firm boundaries, and when I'm at work, I'm working. When I'm at home, and I don't try to mix the two. I separate things well. There's a cutoff time for me on a daily basis, and on the weekends, I try to devote that time to myself and my family. So for me, I'm very consistent about boundaries and time and how I manage my time. That helps me a great deal. And I also make sure to get a great deal of sleep because that helps keep me fueled and ready to take on what the next adventure will be.
Absolutely fantastic. Well, thank you so much for coming online and sharing your story with us today. It is just inspiring to meet women who are out there supporting, advocating for the rights of those who are marginalized. Now, because the world is flat and we have use of the internet, what is the best way for people to connect with you?
They can find me on my website at www.drjameca.com. You can send a message that way. Or you can find me on TikTok or LinkedIn at Dr. Jameca, Instagram at Dr. Jameca, any of those places, and send messages if you're trying to reach me.
Fantastic. Dr. Jameca, thank you so much. It's been an absolute pleasure meeting you today. And thank you to everybody who's tuned in. The Her Story Circle is not just a podcast. We're a social impact movement that brings you the voices and stories of women from all over the world. We share our stories to empower you. And today we've brought you a health professional who can help take you from where you are now to where you're trying to go. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And thanks again for the interview. Bye for now, everybody. Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making her story.